Nimesh Desai. I'm a psychiatrist and a public health expert who has been at the Institute of Human Behavior and Allied Sciences (IHBAS) नाम की जो संस्था है पिछले 20 सालों से और पिछले 7-8 सालों से मैं IHBAS का डायरेक्टर भी हूँ. So we are currently recording this in the office of the director IHBAS. The subject of mental illness and mental health are relatively new in human history. About 100 or 150 years ago, mental illnesses were never recognized as illnesses or health problems. All that the society recognized is that some people who behaved extremely abnormally were seen as lunatics. Lunacy was the common word used, and people were put away or thrown away in mental asylums, not primarily for looking after them, but more for the safety of the people in the society. Because the society used to be so scared of people who had abnormal behavior and who were seen to be lunatic, that they were put away in mental asylums, mostly locked in for years. As the sad reality conveys, there was only entry into the mental asylums, there was no exit. Almost everybody who went into mental asylum went out only when he or she died. About 150 years ago or a little over that, the first revolution began. That people with mental illness who were kept chained in mental asylums began to be unshackled. For the first time, some reformers began to see people with mental illness as human beings and not as animals to be tied down and chained. That was the first revolution in psychiatry by Philip Pinel in the late 19th century or early 20th century. The second revolution of psychiatry came with Sigmund Freud. And Sigmund Freud came up with his theories of psychoanalysis and tried explaining the psychological basis for people who had hysteria or anxiety or depression. The third and the major revolution in psychiatry came up soon after the World War. In the 1950s, mostly by accident, fortunately, two major groups of medicines got discovered. In 1952, antipsychotics, starting with chlorpromazine, and in 1957, imipramine for treatment of depression. Chlorpromazine, that one molecule, and many other antipsychotics after that, discovered in the same line, are very effective in controlling all forms of psychosis, mainly schizophrenia. People with those severe mental illness would have hallucinations, delusions, bizarre ideas, very disorganized behavior, and stuff like that. The antidepressants introduced in 1957 with imipramine started the whole trend of being able to treat depression, the disease, the illness of depression, with medicines. One must remember that these medicines did not come through a logical route of science research. As I said, they were accidental discoveries. By the 70s and 80s, although the medicines were being used for about 20 years by then, science began to understand the brain mechanisms for schizophrenia, depression, and other mental illnesses. It was indeed in a way obverse because by understanding the effects of those medicines which were effective on the brain, the scientific theories grew that since dopamine reduces the antipsychotics like chlorpromazine, since they reduce dopamine levels, schizophrenia must be because of excess dopamine in a certain area of the brain. Because imipramine and the other initial antidepressants reduced the level of norepinephrine or adrenaline, increased those, it was believed that in depression, norepinephrine or adrenaline is deficient. The second generation of antidepressants dealt with the chemical serotonin. By the turn of the century, in the 1990s and about 2000, it was well established that specific changes in some chemicals in specific areas of the brain lead to different kinds of mental disorders. So this was one major impact of that third revolution of psychiatry, which is essentially use of medicines, the psychopharmacology. What's important to understand is that, in other words, earlier, even up to the middle of the 20th century or up to the 70s or 80s, Psychiatrists were seen only to be working in mental asylums, at best giving these medicines in those initial years to people who were very violent and troublesome. Only by the 60s and 70s it began to be recognized that people with mental illnesses who were locked away in mental asylums actually could be treated and brought back to the community. So this was the major reform that happened post-World War. Mental hospitals began to be either closed down or reformed. People who were put away in thousands in those mental hospitals and mental asylums began to be discharged from the hospital like any other hospital and going back to the community, living with families, very often working and making an earning. The scope of psychiatry and psychiatric disorders also increased. Schizophrenia, mania, paranoid disorders are what used to be called psychosis or what is now called severe mental disorders, where the common link is that everybody with severe mental illness has no insight into one's problem. So a person with schizophrenia or mania or delusional disorder doesn't recognize that he or she has abnormal thinking, and because of that abnormal thinking, abnormal actions. The person is in his own or her own fantasy world. Sad to say, he or she doesn't suffer so much, at least doesn't recognize that he or she is abnormal or is suffering. Often people suffer. And so psychotics, people with psychosis, psychotics as they were called, were generally brought to the doctors or the hospital. On the other hand, the other group of disorders or problems, which is much more common, is what was called neurosis and is now called common mental disorders. Depression, anxiety, obsessional disorder, phobia, these are the neuroses or the common mental disorders where the person is very aware of the surroundings, accepts the fact that one is suffering, accepts the need for help, and actually reaches out for help. Depression is one of the commonest mental disorders in psychiatry, as is well known by now. The expanding scope of psychiatry kept enlarging, and you now have people with substance use disorders, alcohol and drug abuse addiction, who psychiatrists and mental health teams can help. You have people with personality disorders who can be helped. You have people with emotional or behavioral problems of childhood who can be helped. You have people with mental health problems, behavioral problems of the elderly, the old age, people with 70 or 75 or 80 years of age. And so the scope of psychiatric disorders kept increasing. Has this always been for good? Possibly not. While the science of psychiatry and mental health and pharmacology, the drug therapies, have combined to bring relief to millions, if not billions of people with treatment, there is also the flip side that's often criticized. If you keep converting every day-to-day experience to a mental disorder, every person with anger proneness or somebody who feels depressed routinely, if you start labeling as a mentally ill person, there is a fear that over time you might have a psychiatric label for everybody, all of us. And we don't want that. We want to recognize that those who have significant mental health problems must be identified and they can be helped with treatment. But we also don't want to turn every day-to-day experience into a psychiatric label. The best part of the story till now is that in last 30 or 40 years we have recognized that in the 20th century, 21st century much more clearly, effective, low-cost, low-risk treatment of mental disorders is possible. I have no hesitation in saying that except for some brain-related disorders which also may cause mental symptoms or behavioral symptoms, almost all of psychiatric disorders or mental illnesses are eminently treatable. 99% if not 100% of them. But what's important to understand here is the use of the word treatable. One is not saying that they are curable. There's a difference that one will have to draw between cure of a disease and treatment of a disease. A cure would mean that the doctors or the health team is able to remove the illness entirely from its root cause and reassure the patient or the person that he or she will never have the health problem again. That's very rare. Only for infections and surgical problems till date, cure is possible. In almost all other medical specialties and all health problems, what's possible with all the advances in medicine is effective treatment, which means that the symptoms are ameliorated and reduced, the person's suffering comes down or comes to zero. Recurrence is prevented or recurrence is less frequent. The person can lead life normally, can earn work, be in the family life, and the secondary complications of the disease will be less. That's effective treatment. And that effective treatment is possible for all psychiatric disorders. The next part of the narrative story is not very pleasant. All across the globe, and certainly in Africa and Asia much more than the other parts of the world, the fact that science has advanced, the fact that treatment is possible, as I asserted a minute ago, this fact has not reached the general population. So the lack of awareness about treatment being possible, associated with the stigma of seeking help for a mental health problem or going to a psychiatrist. The stigma because psychiatrists were seen to be dealing with only lunatics. And so obviously any mental health problem, any psychiatric problem or consultation with a psychiatrist is seen as lunacy, somebody having gone mad. Because of that long-standing stigma, even those who have genuine problem and who might want help hesitate to go to a psychiatrist or a hospital. So the lack of awareness and the stigma are two major factors for what is called a treatment gap. Globally, and certainly in India and Asia, South Asia, the treatment gap is about 80%. So only 2 out of 10 people who require treatment and who can benefit from treatment actually reach a mental health service. We haven't said this earlier, but psychosis and neurosis put together, severe mental disorders and common mental disorders put together in India and South Asia, the frequency or the prevalence, as it's called technically, is about 10%. So 10 out of 100 persons have in India diagnosable, treatable psychiatric disorder. The second part, as we said just now, is only 2 out of those 10 people actually reach anywhere. So the other 8 people as well as their families continue to suffer and suffer for years and decades. Beginning 1990 and by the turn of the century 2000, there is very good global data, including India, that one of the significant mental health problems is depression. Indeed, depression is becoming one of the significant public health problems across specialties. It was predicted in 1990 that by 2020, depression will become public health problem number 1 or 2. It's already happened so before 2020. And this is important to recognize. As compared to all the other well-known and celebrated, almost seductive health problems like cancer, cardiology and stuff, mental health problems and specifically depression has the highest level of death rates and suffering of individuals and people. Public health data from World Bank as well as WHO has established this. And so that has helped focus attention of the general public, policy makers, financiers who manage health services on mental health problems in general and depression in particular.